increase of 9 since yesterday's report. Our thoughts and prayers, our best wishes, our sympathies are with each of those families. This will be an incredibly difficult time for them. I can provide you with some further information. 1 male in their 60s, 1 female in their 70s, 2 females and 2 males in their 80s, 2 females in their 90s, and 1 male in his 100s. 7 of those 9 deaths are linked to aged care outbreaks. There are 626 Victorians who are in hospital. 40 of those are receiving intensive care, and 25 of those 40 are on a ventilator. A total of 2,049,235 test results have been received. That is an increase of 20,326 since yesterday. I'll come back to testing in just a moment. There are 3,808 cases with an unknown source. That is an increase of just 24 since yesterday's report. Health worker infections, which remain a significant challenge for us, 668 healthcare workers who are active cases. There are 1,732 active cases in aged care settings, and the total number of active cases across the state, 4,421. In terms of the regional metro split, we have, in terms of the new cases, there are about 15 of those new ones we've reported today that are in regional LGAs. There's a number that are still being investigated, but in broader terms, 4,022 in metro under stage 4, some 269 in regional Victorian communities under stage 3, and there's always that number that's still being reconciled and being investigated by our coronavirus detectives. I was just talking with the Chief Health Officer about it wasn't so long ago that we were reporting about 512, I think was our top number in terms of active cases in regional Victoria, with some concentration in Geelong, Bendigo and Ballarat. So to see that number coming down is very important to us, particularly in those larger cities. There are, in Greater Geelong, 109 active cases, Greater Bendigo 25 active cases, Ballarat has 13 active cases. So those numbers are falling and or stable, and they relate principally to a number of larger outbreaks, and once their 14-day period or whatever the equivalent finishes up being for them, we should see those numbers come down further. I wouldn't want that to have any sense of complacency in the minds of any regional Victorian. These numbers are low, they're trending in the right direction, and that's good, but please come forward and get tested if you have any symptoms whatsoever, and that remains the message right across the board. To be up above 20,000 tests for the day yesterday, that's a fantastic effort. To be over 2 million tests now it is a very impressive thing, but we've just got to keep those testing rates up. We've got to make sure that people are coming forward, even with the mildest of symptoms, as soon as you get those even mild symptoms, and then stay at home until you get your test result. It's a massive, powerful, critically important thing that every Victorian with symptoms can do, and it will get us to the other side of this quicker. We did see a little drop earlier in the week, but those numbers are now back in a frame where we're confident that we've got a good solid picture, the surveillance benefit of that, so a sense of what's going on across the Victorian community. But the more people with symptoms who get tested, the better off we'll be to try and drive these case numbers down. That's the truest picture and the most important thing in many respects that Victorians who've got even mild symptoms can do. Please come forward and get tested. There's more than 190 sites across the state. We'll get your result back to you as quickly as we possibly can. And in doing that, you will have made a massive contribution to us getting to the other side of this second wave. In terms of just a couple of other updates for you, aged care, 1,732 active cases and 126 outbreaks. In terms of shifts that have been worked by hospital nurses, that number has now grown to 2,246 shifts. And I'll again take this opportunity on behalf of all Victorians, and particularly, if I may, on behalf of families who've got loved ones in aged care, to thank each of those nurses, personal care attendants and others who are doing an amazing job, leaving their normal hospital job to go and work in an aged care setting that is under considerable pressure and stress. That's a really important contribution, and we're deeply, deeply grateful to each and every one of them. In terms of disability, we have total active cases 62, of which there's a total of 60 sites that have got active cases. So that there is some stability come to the disability facility sector, but it's very important, having in real time demonstrated how effective even though there's great challenge and it's by no means easy or over, the arrangements that we've had in place in a very strong and close working partnership with the Commonwealth have served us well, I think, in aged care. And that's why today I'm very pleased to be able to announce that as an extension of the existing and current arrangements, our government and the Commonwealth government have agreed to set up a Victorian Disability Response Centre. This is essentially mirroring the arrangements we have in place for aged care, and that's all about making sure all the right people, all the most senior people are at the same table each and every day, monitoring what's going on in these settings and making sure that we've got the most appropriate response, the most rapid response, to make sure that we protect vulnerable Victorians but also staff. And to that end, there's a $15 million shared commitment, a 50-50 split between our government and the Commonwealth government, to try and reduce mobility of that workforce. This is all about trying to make sure that we don't have staff working as much as we can, and some of this is home visiting, some of it is very, very challenging to have no multiple work site, but at the same time we think we'll be able to drive that number right down and have less and less staff working in multiple sites, and therefore that dramatically reduces the risk that any staff member unknowingly may pose in terms of spreading the virus as they go about their very important work. That $15 million, as I said, shared, and will be a really important way through a series of payments, a fund, a worker mobility reduction payment scheme. That'll be about compensating workers who may be out of pocket because they only work at one site, rather than the multitude of sites that would be their normal working week. We're grateful to them. That's not easy, but with that payment, that'll mean that we can support them to in turn keep their clients safe. And we all know that in that sector, that's what they're motivated to do, to provide the best care and support to their clients. Again, can I just thank the Prime Minister and the Federal Government for their partnership. This is yet another example of us working together to deal with a common challenge. And it's really important that, given the vulnerability of many people across these settings, it's very, very important that we have a singular focus and all the senior people around the table at the same time, and that funding to be able to limit the amount of workers who are going to multiple sites. This is a very important step forward, and I'm deeply grateful to the Prime Minister for his partnership and agreement to essentially expand some of the arrangements that we've had in place already. Beyond that, I'd simply say that whilst tomorrow's numbers will be for tomorrow, we are all pleased to see a 1 in front of these additional case numbers, and to a certain extent it is perhaps at that level a little quicker than I thought that it might be. Of course, this Sunday marks the 3 weeks since the curfew was imposed. Next Wednesday marks 3 weeks since the most significant of the workplace restrictions came into effect. To be at this point shows that the strategy is working, and what that shows is that Victorians are in growing numbers, the vast majority, and I think an increasing number of Victorians are doing a mighty job in very, very difficult circumstances, following the rules, limiting movement, and therefore limiting the spread of this wildly infectious virus. I want to thank each and every Victorian who is making a big contribution to this strategy working. I want to thank them and their families. I want to thank people from all backgrounds, from all parts of the state. No matter your perspective, this is a challenge that none of us are immune from. We're all in this together. We say that a lot, but it's true. It's absolutely true. And because I think more and more Victorians are making the best choices and looking out for each other and therefore everybody, we are seeing these numbers come down. Having said that, you know that I'm naturally conservative when it comes to these matters. We'll wait and see what tomorrow holds, but there's no room for complacency. There's no way that we can assume that this is over. It is an ultra-marathon, and we're not halfway yet, and we just have to keep pushing forward to make sure that we drive these numbers down even further to everyone, every single person, whether you're in the smallest of country towns, a big regional centre, the suburbs of Melbourne, the centre of the city, to every single Victorian who's playing a part in these numbers falling. Thank you so much. To thousands of Victorians in the emergency services, in our public health team, in our hospitals, in our aged care facilities, who are working as hard as they possibly can to save lives and to protect people from this wicked enemy. Again, not just from my government to you, but from my family and every Victorian to you and your family. Thank you so much. I now might ask the Chief Health Officer to speak about the numbers of the day, and then of course we're happy to take any questions you have.
Thank you, Premier. Certainly I'm just as pleased with the number, with the one in front of it for today. The trend has been down, but it is one day. I do hope that we can see that continued trend, but I would sound a note of caution. We're going into a challenging phase in the next couple of weeks. I guess every phase has been challenging, but the challenge of the next couple of weeks is that even as community transmission goes down, those complex outbreak settings that are really hard to get on top of transmission in aged care, in the disability sector, even in our health services, they might end up with a baseline level of transmission that is harder to shift. I think it's great that community cases will come down, our mystery cases will come down. That means that the opportunities for introducing infection into an aged care setting, a supported residential service, even in our healthcare, our acute healthcare settings, the caseload will be less, and so the potential for outbreaks will be less. But the ongoing challenge of managing within those settings will remain. And so even though we're seeing numbers below 200 today, there might be a flattening off in the next couple of weeks if we don't really focus all our attention on those complex settings. And obviously the establishment of the combined disability response akin to the aged care response is a really positive development. We need an integrated response in the same way as we've set up with the healthcare worker infection task force. There are lots of systems issues that need to go through in all of those settings, right from the personal protective equipment, but also about the resident and patient flows, the flow of staff, the training and awareness, and the health and safety issues around infrastructure and ventilation and a number of other things. So that all needs to be looked at very carefully, and a systems approach needs to be taken to get across those complex settings, because they are not easy to manage. But it's terrific to see our new cases fall. And as I say, as community numbers come down, then the opportunity for outbreaks and clusters within those settings reduces. And of course, we're protecting our rural and regional brothers and sisters as we're driving cases down in Metro Melbourne. That's a really important aspect about why they've turned the corner. Obviously, there's been terrific follow-up with our regional hubs, public health hubs looking after those cases. But also there's been less seeding into regional Victoria, which is really important. Happy to take questions.
Can I just ask about how people can think about the numbers? In America, they telegraph, these are our KPIs over 14 days with case numbers and with contact tracing capacity. I think they do the same thing in South Korea and Japan. Why don't we have in Victoria some public benchmark so that we know when the numbers get somewhere what's happening next?
Certainly we'll look to some kind of benchmarking, and we'll have KPIs of a kind in terms of the performance measures that we're looking at. But unlike the US, which is not heading to zero by any stretch of the imagination, we are looking to get to zero community transmission if it is at all feasible. And so that means that there are lots of caveats around what our numbers are. It's one thing to get to 10 cases, but if they're all mystery cases, we don't know where they've come from, and we don't know exactly where to focus our attention and energy in addressing them. That's a trickier problem. than an outbreak of 10 cases where they're all known, where the chains of transmission are well established. So there isn't a magic number in that sense. I know people are looking for certainty, and certainly people are looking for some kind of assurance that we'll get to the other side and there'll be a lifting of restrictions. That will be the case.
I guess people just want to have a bit of a better idea of what your thinking is, what your benchmarks are.
It's a smorgasbord of factors. You know, how long are people taking between symptom onset and getting tested? How long are they taking between symptom onset and isolating? How many close contacts do they have for each person? They're all part of the KPIs that we're looking at internally, and that I think we should have available publicly as well. The trickiness is that's 20 plus indicators, and it all interplays in a way that means that we kind of have to make a more organic judgment about where we're headed and what it means in terms of lifting of restrictions, or the kind of lifting of restrictions that we do.
So in layman's terms, the bulk of these new cases we're seeing today and yesterday, are they in clusters that you already know about? Are they in aged care, disability? Is that something that gives you a bit of optimism, I guess?
Yeah, a lot of them are. Overnight, we've linked 42 already to outbreaks or complex cases, so that's a reasonable chunk. There are a number that we know are aged care and other healthcare workers. That's both concerning, but also, it is an indication that it's not sporadic community cases where we don't know where the transmission is occurring. But that's one of the factors that we look at over time to see the proportion that are outbreak and cluster linked versus those individual community cases.
So in layman's terms, what your answer to Raf is basically, do you have an idea in your own mind what the figures are that you want to see by September the 13th? And also, do you agree with the Premier that we're a bit more advanced than you expected?
No, I think we're about where I expected us to be. Neither better nor worse. I think, it's great that we're there, but in terms of September 13th, it is a long way away, and it's not just the case numbers, it's not just the new case numbers. I'd love us to be below 50. I would be really gratified if it were in single figures, but I'm not convinced that it will be. I think it's possible, but I think there are really significant challenges to get there. If we were in single figures, I'd be very relaxed.
And does it matter where New South Wales is? Will that affect our decision? If they can't, if they're showing that even where they've come from a good place and they can't get it under 20 a day, does that change your thinking about what we do?
Not entirely. Look, I think New South Wales are doing a terrific job in keeping their numbers below 10 on a daily basis. Their mobility data suggests that people are behaving differently, which is another really good sign that they can stop transmission just because they've got lots of voluntary mask wearing at the moment. People are keeping a distance more in the surveys that they're doing in New South Wales. The proportion of people who are saying they keep 1.5 metres away from everyone all of the time is not insignificant. And so even though they've got some mystery cases, the fact that people are behaving differently means that they do have an opportunity to end transmission in New South Wales with the approach that they're taking. If they've got 200 cases a day, I think it changes our reflections in Victoria, but let's see where they're going. They're doing a terrific job.
New South Wales cases in regional Victoria. Sorry, there's 15 new cases today in regional Victoria. Is that a cause for concern, given it's roughly 8% of our new cases, or is that where you want things to be?
No, I think regional Victoria has been trending down very well as well, maybe faster than Metro Melbourne in terms of the proportion coming down each day. And I think that there's a fair few of those new cases in regional Victoria that are known to be close contacts or part of clusters. Again, that's a reassuring element.
New South Wales did 32,500 tests yesterday. We did roughly 20,000. I realise that part of the fall in testing for us has been because people aren't, may not have flu-like symptoms as much because they haven't been mixing as much. But should we be aiming, we're a state with a similar sized population and a much bigger corona caseload. Should we be aiming to be closer to their 30-odd thousand?
I don't think so. I think there's no magic figure in terms of testing numbers. We want to keep it above 20,000. That would be good. I don't know that you get extra value in 30,000 or 40,000 tests necessarily. you push out the turnaround time. New South Wales will be pushing out their turnaround time as they stretch to 30,000 plus cases. And when you've got a long turnaround time for your results, you've got people potentially who are infectious moving about in the community. So there is a balancing act to do there. I think the main thing with our 20,000 plus tests every day is that people who are symptomatic are going and getting tested. That's the primary thing. But in part, it must be that we've had a really long haul in Victoria. We've been doing this for 7 months. It's a bit easier in New South Wales where they've had a quiet period, relatively low testing numbers, and they're doing a real push at the moment, but that's important for them.
Is there an argument to open up testing to people who don't have symptoms, because we are told, a number of people who don't show symptoms but still have the...
Not from my perspective. So asymptomatic testing can have a place where there's a reasonable likelihood that someone will be developing symptoms shortly thereafter, so they're pre-symptomatic, or where there's a real significant chance that they've been exposed. So in an outbreak in an abattoir where there's a case or an outbreak in an aged care or disability services setting. But in the general population, you've only got like a 1 in 5,000 chance of finding a true case in someone who's got no symptoms. So to do 5,000 tests, again, which pushes out your turnaround time in getting results, is not a good investment in your testing capacity.
Does the data show that health work is about 75% of getting this virus at work?
We've still got the formal analysis and report to come through that Safer Care Victoria and the Chief Medical Officer are leading the way with. But I think it will show that the great majority of infections are occurring in healthcare settings. What we need to dig more deeply into is exactly how those transmissions are occurring. There'll be some that are from patient to staff, but there'll be a number that are also between staff, and we need to actually address all of those transmission chains and all of the potential gaps and learnings that will come out of that report, because it's not simply about addressing PPE, it's not simply about addressing patient or staff flow, it's about all of those systems issues that I talked about.
But that data must be pretty close when there was...
It is pretty close. I would expect it by the end of the week, certainly.
But you said the vast majority are at work, or picking it up, it's in some way at work. I thought the other day the Premier was saying the vast majority weren't getting it at work.
I don't know.
Is that in conflict? Or?
Yeah, look, I don't know what the reference was, but we had limited finalised data. So there was a huge chunk in those healthcare worker infections where they were still under investigation. So the minority had been determined to be at work out of all of those that were being investigated. But I think when we settle the investigation, it'll show, and we shouldn't be surprised, that they're primarily acquired in the workplace setting. But we need to understand exactly what the transmission pathways are there.
And on the stresses that everyone is under, we know domestic violence is up, we're not sure of the scale. We know self-harm is up. Can you explain how you balance the harm that's being caused versus the harms that you are preventing from happening?
It's a terrible dilemma, and it's not easy, and it's not just for me to address. The whole of government is looking at the potential impacts and all of the things that they're trying to do to reduce those awful harms of isolation and the psychological and health harms and harms from domestic violence that arise. So there is a piece about addressing that. But for me, my understanding is that if you do not address the numbers in terms of coronavirus infections and the spike that we saw either in the first wave or in the second wave, the trajectory of not dealing with that is literally 15,000, 20,000 cases per day. And if the number of deaths we're seeing now is happening with hundreds of cases a day, you can imagine what the burden of illness and death is with thousands of cases a day. And you can imagine what that means for our healthcare staff, the hospital system and intensive care. And that's when, even our 700 ventilated spaces could be overwhelmed.
So are you confident there's still more harm being prevented than caused?
Absolutely. And I think that's the picture around the world in terms of how everyone's responded with the restrictions that are necessary to make sure that it's not unmitigated. When it's literally left to naturally increase exponentially, you see mass graves being dug. That is what happens when you don't address
stage 4 to stage 3 is not the difference between mass graves or not, is it? People get really stressed. They might be a lot happier under stage 3.
Yeah, that's right. I think we need to look at the things that will support all of those important elements in life: people's psychological health, people's access to healthcare, and all of the other dimensions that are important.
Do you have any predictions on what's going to happen to the daily death rate? Do you expect that to stay at a similar level or to drop in coming weeks?
It'll definitely drop in coming weeks, but we'll still see deaths, knowing the cases that we're seeing at the moment. But it is somewhat optimistic. I've seen in the numbers that about 15% of our cases are 65 years or above. So that's a minority of our total daily cases. They are the most vulnerable group in terms of dying, and so it's important to see that we're not seeing great numbers. I think our aged care cases, we're getting on top of them in terms of the residents who are getting infected, and that's really useful and important to protect them.
Just in terms of some of the steps you took for aged care about stopping staff moving between different sites, given those lessons, why wasn't that implemented for disability care, given it's a very similar situation with staff moving between sites?
Look, I think people have been looking at that right through. You'd have to ask the disability services area in the department.
I guess it might be a question for the Premier.
Yeah, it might be a question for the Premier.
Given it's a policy response, why have you waited, I guess, to implement this one worker, two sites?
I wouldn't say that that's a notion of delay or anything like that. There's much smaller case numbers. We want to keep it that way. So it's an important partnership. It's a very diverse sector. There are a number of pure NDIS services, a number of others that are transitioning to that by the end of the year. It's also, Rich, can I say, unlike aged care, where you do have, just by its very nature, you may have, and particularly if you do a bit of a crossover into that supported residential service sector also, home-based outreach, home-based care is a feature of both of these sectors. So the notion that it's in any way easy to have someone who might normally support in the course of a week, we'll just pick a number, 12, 15 clients, suddenly it all becomes one-on-one, that's a very challenging thing to do. So before we were out there making commitments about trying to drive down the number of people who are working in multiple sites, we needed to make sure that we'd be able to do that. That's the work that's gone on. So there's a framework there. We've just kind of taken that to another level, and I'm very pleased that we'll be sharing the costs of that, because I think the benefits will be significant in that I think this will mean we don't see, at least it'll make it more likely that we can keep this out of more and more of these settings.
I have a question for Professor Sutton. Sorry.
Sure, no worries.
Has there been any case studies done to find out exactly how Victorians have got sick and the exact mode of transmission in each case?
Not really. Like our case interviewers go through that process, so they're certainly not just looking at the close contacts while they're infectious to follow up those close contacts and make sure that they're quarantined. They are also going into the 14 days before someone's become symptomatic to try and determine the acquisition, so where they got it from, how they got it. So there is that built into the interviews routinely, but there hasn't been a specific research piece to collate all of that together. It'll be of great interest to understand, but our priorities at the moment are obviously the ongoing transmission and managing the close contacts for every case.
Has
With those numbers coming down, last week there was some discussion that stage 4 restrictions could be a possibility for some parts. With those numbers coming down, does that mean that you can consider put that off the table, those stage 4 restrictions? And conversely, would there potentially be an argument for regional Victoria to come out of stage 3 a bit sooner?
Yeah, everything's on the table all the time in terms of how the numbers go, but it's absolutely encouraging to see those numbers come down in regional Victoria. And yes, it becomes a smaller and smaller probability that anything greater in terms of restrictions would be required in regional Victoria. That's a true statement for Metro Melbourne. If we're going in the right direction, then the likelihood of needing stronger restrictions becomes less and less. In terms of coming out early, again, we just watch the numbers week by week. I know people want that level of certainty to the extent possible, but we don't know what the tail might look like in regional Victoria. It's certainly coming down at a decent rate now and is looking to be on track for mid-September. But we just need to review it on a day-by-day, week-by-week basis.
Has Victoria done sewage testing? The federal government or the federal advisors are very keen on it. Have you done it? How extensive and what's it shown?
We have done it. We've been doing it for weeks and weeks. So there have been samples, hundreds of samples collected and frozen. We're now looking at fresh samples because the frozen samples that had to be collected before there was testing that could be done on them they've been degraded somewhat by the freezing process. So we need fresh samples as well. And we're looking at that across Victoria. There's been a significant state investment in that testing capacity, and we're now going through a process of validating those results to see what it tells us. Does it pick up when there's a positive case, for example, in a regional area where we don't have a confirmed case? And if sewage testing is negative, to what degree do we have an assurance that there are no active cases out there? So that's all being worked through at the moment, but we've got an extensive program underway.
And when are you likely to get results?
So there are results coming through now, but they do need to be validated. We need to have the confidence that a positive test in sewage reflects active cases in the community, and we need to have an understanding of how far away would someone need to live from the sampling point in that sewage catchment to give us the confidence that it's telling us the right answer, if you like.
Premier, any more clarity from National Cabinet around those border communities, farmers being able to cross the border, South Australia, New South Wales?
Just before I do that, Rich, just on wastewater, obviously it's a little bit like the app. Once you open up, I think that's when the true value of having that kind of surveillance picture, provided we can prove it all up, that it does give us an accurate snapshot of what's out there, then that becomes obviously something that we can do day by day, and that'll be all about monitoring, particularly once we've got many more people moving around the community. So I think it'll come into its own then. It's not unimportant now, but it'll be of greater utility afterwards.
But it has been adopted elsewhere and appears to be successful.
Yeah, that's exactly right. I think all I'm making the point is I think that it might be of even greater benefit as a broad community-wide or geographical area-wide surveillance tool, rather than trying to diagnose people in the middle of a second wave, if that makes sense. On borders, yes, there was a discussion at National Cabinet, and I'm very pleased to say that I'll continue my discussions with Gladys in relation to trying to get some common sense changes to some of those border restrictions to the north, and I'll be speaking with Stephen Marshall later on today about a number of communities. There are 8 or 9 communities that run down the South Australian border. We have one carve-out, but we think we should be able to do the same thing. We're going to work towards doing the same thing for a number of other smaller communities who shop, get their fuel, all of those things just over the South Australian border, and to travel to a Victorian equivalent service provider is hundreds of kilometres as opposed to 20, 30, 40 Ks. So I'll be speaking with Stephen later on today, and all of our officials are working together very closely, because look, I understand why these borders are shut. It's not a criticism of that. That's a decision that's been made, and if I were in their shoes, I would have probably made the same choice. But we just got to try and make it as workable as we can. And the good thing is that there is real goodwill and a genuine interest in not undermining the public health imperative to not see the virus spread, but to be as sensible as we possibly can be, and indeed in some of these cases to be as compassionate as we can be.
Did you get much sort of feedback, I guess, from them that most of the cases are in Melbourne, and even the regional numbers are going down and are restricted to sort of Bendigo, Ballarat, Geelong?
If you look at, we didn't specifically talk about some of the announcements. I think we're chasing that up separately around the Goulburn Valley and Bendigo, I think, out of New South Wales. The ag worker permit arrangement is a big step forward, but we don't want anything to detract from that. So we'll keep talking with New South Wales, and I'll no doubt have a conversation with Gladys over the course of the weekend if there's any other issues I need to raise. But I'll speak with Stephen today. We agreed during the meeting that we'd have a chat just about a couple of, they're often very small, but it's meaningful, very small border communities who it is a big impost if they've got to travel all the way back into Victoria, much deeper into Victoria than their normal pattern of movement, which is quite a short trip. There are no, if you draw, the bubble that they've drawn, I think is a 40-kilometre line back across, back into our state. We can confirm for them that in all the local government areas that run up and down the South Australian border, there are no coronavirus cases. So it's just a matter of us connecting and hopefully being able to come to a common sense agreement. Let's have what needs to be there, but some of the other stuff that maybe is not proportionate to the risk and is making life really challenging for those border communities, let's see if we can try and fix some of that up.
You were asking about it particularly.
In regards
Certainly.
to agriculture,
Yep.
you mentioned the New South Wales permit there.
Yes.
Do you think there's any prospect of a similar arrangement with South Australia?
Well, I think it becomes a template. I think that the positive progress that we were able to make with New South Wales, if it can work between New South Wales and Victoria, then it can work with other states. So that'll be a feature of some of the discussions that I have with the Premier of South Australia today.
Yesterday you...
Now, follow-up, Simon.
Yes, thank you.
Sure.
You mentioned a carve-out of some of those specific towns. Did you say one had already been agreed to?
I'd like to try and get. Let me come back to you before you quiz me on exactly how many people live there and exactly which one of the 8 it is. But I'm very keen to try and have, if we can. I'm not committing to this. It's what we're working towards. Let's try and have all those border towns. Let's try and have all of them with a proportionate set of rules. All of our intelligence tells us there's no cases there. There is a bubble. Maybe the bubble just needs to be a little bit bigger. Move that South Australian border in effect further into Victoria, just a once only, I should add. But I think we can. I think that there's genuine goodwill. And look, I wouldn't want anyone to think that Gladys or Stephen or Peter down in Tassie have done any of this out of anything other than they are fundamentally motivated to keep their community safe. And we'd make the same choice if we were in a different place. So it's not in any way a criticism. It's just a genuine commitment and a plea from us, which has been answered, to work together to make these as workable as possible. I don't think you'll ever make closed borders easy, but we can make it a little easier in a number of areas, and they're the sort of discussions that we're having.
And what's your response to the, I suppose, the involvement of the federal government this week in terms of Scott Morrison writing to the premiers, calling for action of this? Are they interfering a little too much in state matters on this?
No, I wouldn't make any commentary on that. I don't think that's helpful. Our borders remain open, but again, I want to stress I am not criticising any state who has made really difficult decisions to keep their community safe. We would do the same thing. But at some point, we're going to have to make this much more workable than it is now. And the good news is that there's a proper partnership and a collaborative process to get us to that point. That may not be as quick as many would like, and I do appreciate, having grown up not that far from that border, the northern one, I do appreciate that it is having a really significant impact on the way people live their lives. That's why our team is working as hard as we can with our counterparts to try and deal with some of those issues. I stress again, not all of them. I'm not committing to getting the border open again. That's not for today. But there are a number of, I think, quite logical things. We've got a good case to argue. We've been arguing it. Let's take it to now a conclusion and have some of those matters, some of them resolved.
Yesterday you were asked about a particular issue with contact tracing, a man whose first call from DHHS was a week after the death of his mother-in-law.
Yes.
You were going to get back to us. I just
Yes.
wondered whether you'd be able to be briefed on that and whether you can see that...
Yeah. Sorry, Lundy. Yep.
No, maybe it didn't work as it should have?
Oh, look, there's no question it didn't work as it should have, and that's why I want to apologise to the family, and I want to make it clear to them that we send our deepest sympathies to them. If anything that any of our officials have done have made this terribly painful time harder for them, then I want to personally apologise. By way of update, I can tell you that we're going to be reaching out to that family this afternoon, if that's not already happened. I haven't got a full briefing on exactly what has happened, but we're going to be speaking with them. And if I can provide you with a further update tomorrow or Sunday, then of course I will.
Nurses and doctors at St Vincent's Hospital, Premier, have gone on social media appealing for nurses and doctors interstate in New Zealand
Yes.
to come and work with them. Does that indicate that at least St Vincent's and many other hospitals are in fact under-resourced at the moment.
I wouldn't say that. What I would say is that there is significant pressure. I'm not sure. I did make some mention the other day that I'd had a rather lengthy Zoom meeting with a number of nurses from a range of different hospitals, some from private aged care as well. I didn't do much talking. It was about listening, trying to hear from them firsthand the sort of stuff they're dealing with every single day. There is pressure there. There's no question. You can't have this many staff furloughed. You can't have this many staff who are positive, and you can't have this big a task without there being some pressure. That's why we're so grateful to all of those staff. They're doing a mighty job. And that's why we're working very hard as well to understand where the source of infection is. Is there something we can do to deal with that? Beyond that, though, there's an even bigger amount of work going on to make sure we've got a reserve workforce. And the most difficult part is numbers will always be a challenge, but it's about matching skills as well. I was talking to one particular critical care trained nurse. She works as a very, very senior clinician in one of our busiest emergency departments. If she was to need a break for whatever reason, basically replacing her is not that easy. You might be able to find a nurse, but whether you can find someone who's got that skill set. So we're having to do quite a lot of work. It is ongoing. We're providing backup and support as best we can across the board. But there's absolutely, there's no way of avoiding the fact that, and I'm not trying to in any way, if you've got large numbers of staff furloughed, as we've seen at Northern, as we've seen at Frankston, as we've seen in lots of different places, then that does put pressure there. And that's why we have to work closely with those hospitals.
It is a desperate measure, though, isn't it, going on the internet and appealing to people?
Well, I won't offer a comment on that, but what I would say is we've got significant support from other states. We've got significant support from the Commonwealth Government. We've got significant support from the private sector as well. And that's the other point too, Nick. It's not just public hospitals that will be feeling this pressure. We've got two different services, private health services and public health services, but they're working together as one system. So you'll finish up with significant numbers of staff, maybe not as many, but still significant numbers of staff that are furloughed in the private system. The other point I'd make to you as well is whenever we talk about 500, 600, 700 active cases amongst health workers, that term includes not just clinical staff, it includes a broader cross-section of people, and it includes aged care. So it's not just hospitals, it includes aged care workers also. So it's a diverse group, diverse skills, there's pressure there, and that's why there's an enormous amount of work going on to try and backfill, as well as to support those people, because you don't have to talk to many, you don't have to listen to many of them to hear some very challenging stories of just how hard it is. And I'll make this point. If you look at the amount of hospital activity during the first wave, I'm not pleased about this, but this is just a fact of it. Because of perhaps fear, because of a sense of, and it was not quite the dead of winter, as we have been in the second wave, we saw many less people presenting to our hospitals. So emergency department presentation was well down. We had less people coming forward to get the care that they need. So the normal demand that you'd face was much less. Now, that's returned to pretty close to normal levels, plus the COVID demand on top of that. So what health service staff tell me is that it's a very, very different challenge to the first wave, and that's why our response is different. We're going to get this data all crunched, and we'll be able to have a longer conversation with you about infections, and we'll also be able to talk about some of the things we're doing to drive those numbers down. And at that point, we might also be able to give you just a few more insights into some of the alternative workforce planning, the furlough planning, all of those things that we're doing too.
Just on contact tracing, it took a few weeks to get one set of numbers about the contact tracing, how, the benchmarks that you are meeting over the first day and
Sure.
with the close contacts.
That's the National Cabinet dashboard, the information that we put into that.
New South Wales give a lot of information each week
Yep.
on how they are going with their contact tracing. We've raised it a number of times, and every time we have raised it, both you and Cho have gone, yep, happy to give you the data. Why can't we have each week, this is where our performance is this
Sure.
week? Because the one set of numbers we got, there's nothing to compare it to.
Sure.
There's no
Let me-
apple to compare it with.
I'm as dissatisfied as you'll be with me yet again saying I'll come back to you. That's all I can say. We've
Do you
got...
feel like committing to releasing it each week, a bit of data each week?
Well, let me commit to this. I will chase up some comparative data for you. The data tells, I'm briefed on it regularly, and the data tells me, and I'm confident it'll tell you and your listeners as well, that the number of people we're getting to in 24 hours, contact everyone. We don't interview everyone in 24 hours because some don't want to be interviewed and some don't necessarily have the right phone number. But between that and door knocking and what is now a team at about, I was slightly wrong yesterday, it's 2,600 in total.
Yep.
Our total flex on the phone capacity is not the 1,400 or 1,500 I said, it's closer to 1,700 I'm told. And the day before, not sure what it was yesterday, but the day before it was 1,000 that were on the phone that day.
So if you get the data regularly, why can't you?
Well, that's a good question. That's what I'm going to go and ask, because I can't recall committing to give you that previously, but I'll take your word for it. The Cho and I will have a chat.
Given we've reached 179 new cases a little earlier than you initially thought, when will stage 4 restrictions
That's
end?
a very good question. I
And
knew I
what
shouldn't
might-
have given you a sort of qualitative sense.
And what might be eased first? What restrictions?
Well, the point of contradiction, if there is one, is that the Cho has always had I've been a little more conservative in my willingness to describe where we're at in terms of a trend. I think we're at the same place. These numbers, it's good that they're coming down. The line is moving in the right direction. However, it is just way too early for us to talk about what easing will look like, or even to be definitive about when that will be. Now, that's not designed to in any way dispirit people or take away a sense of hope. We can be hopeful about these numbers. We can be positive about these numbers. But that can't be accompanied by any sense of complacency. It can't be accompanied by, this job's done. And now rules that were really important when we had 500 cases are suddenly not as important because we've got 170. They are just as important. And arguably, your margin for error when you're trying to drive down to such a low number, individual choices, individual outbreaks, individual positive cases have a much bigger impact on the overall. So it's as frustrating, as challenging, as fatigued as people are, and I get that. We've just got to keep pushing forward. There'll be a time when we can talk about when we're going to ease, what that will look like. That isn't today, and I know it's frustrating that I can't tell you when that day will be, but it'll be when the numbers tell us that we have defeated the second wave. It will not be in a search to be popular, ending this fight too early and really just beginning the process of a third wave. That we've got to do everything we can to avoid that.
Do you have an idea yourself what those numbers are?
Well, I'll be guided by the advice, and I think the Chief Health Officer's just given you a few numbers, under 50 down to single figures, very low community transmission, all those things hold. I understand why people want that certainty. I'd like it too. And one of the most frustrating things about this virus, this wicked enemy, is that you can't see it. You know it's there, you know it's stubborn, and you know that the thing that its fuel, the thing that it really feeds off, is a sense of fatigue, a sense of complacency, and any sense that we're not equal to this task. There's a lot of pain out there, there's a lot of hurt, but we've got no alternative. We've just got to find a way to get to the other side of this, and I'm really confident Victorians can do that. These numbers are coming down, the strategy's working, but if we opened up today, we would not have defeated the second wave. We would just be starting the third wave. And I really don't think anyone in business, in any community, from any background, wants us to do that. As tough as this is, we've got to see this thing off. Not necessarily, 30 days of zero, but down to a series of numbers that are so low that we have real confidence that we're able to keep a lid on it until we get the vaccine.
When do you think we'll get to double-digit figures?
I'm not sure. The day that I can report double digits for you, I'll be very pleased.
I mean, there's a few inquiries underway at the moment. I'm not sure if you've been watching either the Victorian one or the Canberra one.
I've just come from National Cabinet. I'm sorry. I'm not sorry to have come from National Cabinet, but I'm sorry I won't be able to, because it was a very productive meeting, as they always are. I will not be able to update you on either of those, I'm afraid. Not that I probably would have anyway, to be honest.
The aged care minister had struggled to tell the inquiry up there how many people had died in aged care settings. I just wondered whether that was indicative of some problems out of Canberra in terms of managing.
I'd make no comments about that. I haven't seen that, and for what it's worth, might be worth much, but for what it's worth, we're working very closely with Minister Colbeck We're working very closely with Minister Robert. We're working very closely with the PM, treasurers, all ministers are working as closely as they possibly can, because this virus doesn't discriminate. It doesn't care who you vote for or what colour your team is. They want, all of us need, and the community want us to work together, and that's exactly what we're doing.
Premier, on the hotel quarantine.
Here you go, Rachel.
On the hotel quarantine inquiry, you've repeatedly said that inquiry should operate at arm's length from the government.
Yes.
If that's the case, why did the Department of Health and Human Services QC yesterday apply to have evidence given at that inquiry by a nurse suppressed?
I've no idea.
My understanding is that application
I'm happy to follow it up for you, but I've got no idea.
Was withdrawn this morning, but I guess in principle, shouldn't it always be up to Justice Coate and not the government's lawyers to be deciding how to treat evidence? And isn't it a pretty bad look for one of the government departments that's responsible for hotel quarantine to be trying to suppress evidence?
I really can't comment on that because I'm not aware of it. It's complete certainty. The first I've heard of that is the question you've just asked me. I'm happy to try and follow it up, but
Sure.
I don't.
And have you at any point been made aware of claims that were that did come forward in evidence yesterday that the body of a person who'd taken their own life in hotel quarantine wasn't found until several days after their death?
No, I don't believe that's been raised with me. The issue of what was an apparent suicide, and we're always very careful with the language that we talk about, and it is just to one person, and I don't want to cut across. That family will be dealing with enough, even though it is some time ago. They'll still be dealing with something that I wouldn't want to make that worse. But I was clearly briefed on the fact that all available evidence was that a person had taken their own life. That's a terrible tragedy, and we sought to make sure that, to the extent that any arrangements had contributed to stress and anxiety, I think we were reassured that had not been the case. As to the circumstances of the discovery of that event, I don't recall being briefed on that, and to a certain extent, I think as that was reported overnight, that's the first I've heard of that. I'm more than happy to check the record, but I don't believe that we were made aware of that.
Sure.
And therefore I don't know if it's accurate or not.
Of course. We're now into our fourth day of hearing evidence at the hotel quarantine inquiry about
Yes.
the Department of Health and Human Services handling of the program. Is there a reason we haven't seen the Health Minister front the media since that inquiry started hearing evidence?
No.
And
Those matters are not connected.
And just finally on that subject, we've heard in evidence just in the last hour or so that a hotel authorised officer was given an hour of equity and diversity training but no infection control training before they were involved in administering that program. Is that appropriate?
I couldn't comment on what training was provided, and again, I might well have a view on that, and you can probably guess what that view would be, but it's not appropriate for me necessarily to be. I don't think we want a situation, and I don't know that much is served. You're perfectly entitled to ask the question. I'm not being critical of you, but I just say I don't think much is served by having Judge Coate, counsel assisting, asking questions of witnesses each day. That evidence is led. Then I turn up here and give you a rolling commentary on who said what and what my views are on that. It's being conducted by someone who's got a lifetime's experience, budget in terms of reference that she needs. And I know it's frustrating. Like, no one wants these answers more than me. Don't be in any doubt about that. But they won't come today. They'll come when the report is handed to me, and then we'll be able to speak about all those matters. And Judge Coate will have answered the questions as best she can, and that'll be a different day to today. I think we've all got enough to go on with. I certainly do to keep me focused on that. That's my exclusive focus. We do need the answers. Very, very important, and that's why we've essentially hired someone to go and get those answers for us.
Just in regards to the testing, if I could, Premier,
Sure.
are you happy and confident that the testing that is going ahead is happening in the right parts of Melbourne? There's been some reports that places, those hotspot suburbs, the north and west testing centres aren't really being used much. There's not much of a queue.
Sure. I did see some reports. I think there was a conclusion drawn about people being, people turning their back on testing. I think that's just rot. That's absolute nonsense. And I don't think it serves any purpose to be drawing those sort of conclusions. I wouldn't want people to think that their fellow Victorians aren't coming forward. We did see a little dip. We've then, been really clear. Getting tested is just such a massive thing that you can do, and we've now seen those numbers stabilise. I don't know. I've lost count of how many days over these last 6-7 months that I've been here talking about get tested, because it's so important. And I think that we've seen some of our retail sites drop off a bit, because the very reason that it was co-located at a retail site was because retail sites are places where lots of people go, except of course when they're closed. But even if we've got 20 people going through a site, even if one of those people tests positive, that's one person that we can put a support system around and stop from potentially infecting heavens knows how many others. But we always look at these things. The other thing too is we've probably got a bit of reserve capacity, so things that we might leave them set up for another couple of weeks, because we know on the other side of this, when that shopping centre or another setting is in a very different place, it's opening up, there's people there, those testing sites will be even more important. So sometimes closing something down only to then have to reopen it a few weeks later actually costs you a good deal more than keeping it there. I think that's probably the best way I can go. What I'd also say again, if you have symptoms, even mild symptoms, come forward, get tested. We're not going to stop saying that. We're going to keep saying it because it's incredibly important, and from a surveillance point of view on the other side of this, testing will be just as important as it is now.
And still on testing,
Sure.
I've asked for the last couple of days from your office for a breakdown of the LGA, of testing by LGA. Is
Sure.
that still being processed? Is that still on its way?
I wasn't aware of that request. You've made that request to my office. They, I think, always try their very best. I'm just looking at them now. They always try their very best to follow up on each and every one of your requests.
I think other journos have requested it too, to be fair.
Excellent. That's even... Yes, no worries. I've just got the thumbs up from the back of the room here. We'll chase that up.
Can I just try once more? You both mentioned now case numbers around 50 or single figures. Is that you don't change the restrictions until you see that consistently, or you don't change restrictions until it looks like it's getting to 50 and single figures?
I'm just processing that, Raph. Sorry. In terms of... Well, probably the best... Each time we've done this, we've tried to give people some notice as we've come out. We've given people a bit of, some sense that this is what's coming in a week's time, say. All I can say to you is, if we are in a position to do that again, that is exactly what we would try and do. Does that mean the Sunday before the 13th, I'll be able to definitively say this is what the morning after the 14th looks like? I can't commit to that. I know and understand, and I appreciate, I really do, how frustrating it is not to have a date, not to have a timetable. This thing doesn't operate that way. And as soon as these trends continue to kind of validate themselves, as soon as continue to see those numbers falling, then the conversation will move into different areas, and as it should. But I don't want to make bold predictions and then have a situation in 2 weeks' time where the data doesn't deliver that, and then we've got to revise it all. I think that's in some respects more damaging than people. I think just being level with people, being honest with people. We can't tell you exactly where we'll be in a day or a week or a month. We can't. But the numbers are going in the right direction. The strategy's working, and there's one reason for that. Because Victorians are doing, I think, in increasing numbers, the right thing. And we're so grateful for that. Without that, we just wouldn't be seeing these numbers come down.
And you're day 50 tomorrow. Have any of your colleagues asked you if you should have a day off?
No, I don't believe so.
No one said... Has anyone you're working with said maybe you should have a day off?
I don't believe so. I think they know what the answer would be, Raf. So they probably wouldn't ask.
Many VCE and VCAL students are back at school today for assessments.
Yes.
How that goes, will that help determine whether schools will open for term 4?
You're absolutely right to say that they're back for some specific assessments and things of that nature, and there are some pretty rigorous COVID-safe plans. I was asked a question, I can't recall who asked me the question, the other day in relation to McKinnon Secondary College. And I think only moments after I left I got a text message. It's a fantastic school, and Pit Sabinian, who's the principal down there, she leads an amazing team, and they were keeping their distance, they had masks on, they'd done all the things that you would expect. I think that in some ways it might be a bit of a trial run for some of the exams, where it's really hard to move them 100% online. But I don't think it'll be. It won't influence what term 4 looks like. I don't think, but it may well have a bearing, given that it's assessment, so it's like for like. It may well have a bearing on some of the mechanics, some of the practical things that we'll have to do in order to get those VCE and VCAL students assessed.
In addition to the healthcare workers that are active cases, how many are having to self-isolate, and what sort of impact is that having on the workforce?
I need to come back to you on that with some updated numbers, but it is a mix. There's obviously those who are infected, those who are close contacts, and sometimes it's not even a close contact via exposure at work. Often health professionals will live together. There'll be people in the same industry who then need to isolate because they've been in contact as part of a social setting, if you like. Let me try and come back to you with some of those details.
Is that having issues on staffing at hospitals?
Oh yeah, there's definite strain there, and that's why we have to. That's why we're doing a lot of work to try and replace, to try and balance. And as I said before, different to the first wave, where we saw, for whatever reason, we saw a significant drop-off in kind of ordinary hospital patient numbers. The number of presentations to our health services was off, and we didn't have a very big COVID workload. Now we've got much closer to normal hospital presentation numbers and a big COVID task on top of that. So that's where there's a lot of pressure there. We're very grateful to every member of the team. I'm told by many that there's nothing easy about doing a very long shift, very busy long shift in full PPE. It's very, very challenging, and that's why we're grateful to every one of them and to their families who would be dealing with a lot of this also. So we send our best wishes and our thanks to them, and they need to be in no doubt that everything we can do to support them we are doing, but it's a very challenging space, and they we call them heroes, and I think we call them heroes for very, very good reason.
And on that note, there is a group of student nurses at Dandenong Hospital who had parked in school zones. They've been fined, even though schools aren't operating.
I think we'll deal with that. I wasn't aware of that, but I'm pretty confident if I ring the Mayor of Greater Dandenong, we'll fix that matter. We're not fining people for saving lives. That's just wrong. Wrong.
Sorry, I just have a question for Professor Sutton.
Certainly.
Okay. Professor Thomas Barotti from the Centre of Digestive Diseases says that patients have been treated successfully with the drug ivermectin plus zinc and antibody. He says, we came up with a treatment that is simple, safe, and can get rid of coronavirus in almost all patients treated within 6 to 10 days. Has there been any inquiries into that treatment?
I think all treatments are being explored through appropriate research projects in Australia. It's not for me to comment, and it's not really for a single individual, no matter how expert they might appear to be or claim to be, to make a claim about their own treatments. It's for a well-constructed research program, randomised control trial with a placebo drug or an alternative arm that demonstrates that it makes a difference. A case series or a case study, that's some evidence, but it's the poorest form of evidence that you can come up with. A well-constructed research program is really how it needs to be investigated. And honestly, it's not for my judgment. It'll be for the Therapeutic Goods Administration and for all the researchers in Australia to look into that. I know ivermectin's been shown in test tube, in vitro, to have great effectiveness against coronavirus. My understanding is that the dose that might be required in humans puts it into toxic levels. And so at the dose that it's given, it may not have effectiveness. And of course, there are, 80% of people are recovering without serious illness. There's that 20% who require hospitalisation or who have severe illness. So it's very difficult to say, oh, we gave this drug to X number of people and they've all recovered. You have to have a well-constructed research program to show that. That's it.
Any other issues? Your day 50 today or tomorrow?
I'm not sure. I'm not counting, Raf. We've got a long way to go. Certainly you can.
On the border restrictions, just going back to National Cabinet. You mentioned obviously further discussions with New South Wales and South Australia.
Yep.
Can you shed any light on how the discussions are going on that national level? particularly for agriculture, we know things from people and machinery from Victoria need to get up to Queensland, for example. Beyond New South Wales, South Australia, what are the prospects of widening up that movement for agricultural workers? There's been calls for perhaps a single permit for the entire industry.
Sure.
Do you have any hope that...
I might need to come back to you on Queensland, Tasmania, some of the further afield. I'm not saying they're unimportant, but rightly I think my focus has been on the more immediate patterns of movement, and that relates principally to Victoria, New South Wales, Victoria, SA. I think we have made some progress there, but it still remains very challenging, and we just got to keep working through it. And as each example comes up, keep talking, keep trying to convince people that there's a very low risk associated with allowing certain things. But I do. Let me perhaps on this issue. Let me just conclude by saying that, you know, I understand as well as anyone, if perhaps better than most, if every exemption does undermine the integrity of the rule or the decision you've made. So you do have to be very careful. If you grant an exemption to everybody, because they've all got well-argued cases, it's a bit like, you know, some in the business community have said, well, I'm safe, why can't I continue working? And the answer is, well, if you say yes to everybody, then we'll have more people at work this month than we had last month. And then we're not reporting 170 odd cases, we're reporting a much bigger number than that. So we'll just keep pushing through with that, keep on following up those individual cases, and I'll come back to you on what we've done in relation to Queensland. That's obviously the furthest one. I've not been directly involved in that, but others will have been.
Premier, do you agree that, would you be supportive of a potentially nationally consistent approach for agriculture? And
yeah, I think people are working to that end. So,
as in a national permit or a national guidelines? What sort of...
Well, again, I'll leave the Prime Minister to speak about National Cabinet today, and you know, I think that this won't be settled today or tomorrow. This will be a kind of a work in progress for so long as those borders remain shut, and there'll be lots of different examples, some of which are obvious to us now, others will only become obvious as people raise them in the days and weeks ahead. Hopefully we can get to a situation later this year where those borders, our second wave's dealt with, we've got that stability, very low numbers, we're opening up, and we can have proper conversations from a position of parity, if you like, about opening up those borders.
Premier, there are rumours going around that you went to Melbourne Airport either 2 or 3 weeks ago to meet with a delegation of Chinese officials. Are they true?
No. I've not been to Melbourne Airport for a very, very long time. I'm happy to check my records, but that's not true, and I honestly cannot recall when I went to the Melbourne Airport last. Probably to fly, actually I'll tell you when it will have been. It will have been when I flew to Sydney to go to the stadium at Parramatta, where COAG was held, where the very first National Cabinet meeting was held. I think that would, I stand to be corrected, but I think that will be the accurate description of the sole extent of my air travel, and I don't tend to hang out at the Melbourne Airport, as lovely as it is, unless I'm flying somewhere.
Have you been doing business with the Chinese government during this second wave?
I wouldn't say that I ever do business, as you put it. I always represent the interests of those in Victoria who need investment and want to export products so they can employ people. But I've not been pursuing those agendas in recent months. I've been much more focused on the global pandemic. So I think that probably, I hadn't seen those reports, but they're not particularly accurate, if at all accurate. Any other issues? Very good. I'll see you tomorrow.
Thank you.
Thanks.